Hi everyone, in this video we are going to discuss about cementing versus bonding of your restorations. While you're preparing or planning for any indirect restoration, one thing you need to consider is whether you're going to cement that restoration or bond that restoration. As we discussed before in previous videos, that techniques varies a lot, and in my opinion, in my clinical practice, if I am doing a porcelain fused to metal crown or zirconia crown, I am going to cement those two crowns. If I am doing Emax or bell glass only, which is modified resin only, then I am going to, or porcelain veneers, I am going to bond those veneers. Now when you are cementing, my go-to cement is Fuji GC type 1 sort of luting cement, which is really good. I don't use type 2 resin modified GIC. I just use a simple luting GIC for cementing my crowns. And to cement my crowns, I would first make sure I use a little bit of Vaseline on my micro brush, hold the crowns so that the inside surface is on my thumb area and holding the crown, and then I would apply Vaseline on outer surface of the area to crown. And then I would use GIC, luting GIC into the crown and then cement the crown. In this way, you will be able to remove the excess material quite easily without it sticking to the crown or surface of the porcelain, and then sometimes it becomes trickier to remove that excess. Otherwise, make sure that the area is dry. I sandblast my metal inside the crown because that helps in getting micromechanical retention, and make sure the tooth surface is clean. So when you remove the temporary crown, make sure the tooth surface is clean, there is no bleeding or nothing's, moisture control is very well, because even though you're cementing, you still need dry surface. So cementing is technically easier than bonding the crown. Now with regards to bonding procedure, there are various bonding procedures described, and there are different opinions. In my practice, I use two different methods. Different method for bonding my modified composite resin onlays or bonding my porcelain onlays. With regards to composite, I would first, tooth-wise, I would treat the tooth similarly in both onlays. So I would etch, prime and bond. So I use OptiBond FL. I don't cure the bond. So I would etch, prime, bond. Before doing that, I would sandblast the tooth to expose that, to clean the surface of the tooth. And I would have done IDS previous appointment, as we discussed in previous video. So I would have done IDS, take the provisional out, clean the tooth using sandblasting, 30 micron aluminum oxide. Then I would clean the tooth, etch, prime, bond. No, I don't cure, bond. With regards to the preparation of the composite resin, I would clean the inside surface of the sandblast the composite, wash the composite. I do use etch, just normal etch, just again to clean the composite. It doesn't do anything to the composite, but I will use that just to clean it, make sure it's nicely cleaned. Dry it, then I would use composite primer, and I would put it in a heater to heat it, because primer needs to be heated. Make sure you don't apply too much primer. You don't want puddle of primer. And when you're using primer, ideally you want to use a single vial primer, so it's just a unidose primer rather than in a bottle. But if you are using bottle, then usually that shelf life is around 6 months. So use a primer on the composite or composite modified onlay, and then heat treat it. Once that's done, while it's heating up, I would have put my composite into a heater or some sort of heat source, including my flat plastic or some sort of instrument which I'm going to use to take the composite from the syringe, if it's a syringe, or gun, if I'm using composite gun. That's heating, and then I would treat the tooth. Once the tooth is treated, I'll come back. If it's onlay, I will put composite onto the onlay, and then put onlay onto the tooth, If it's inlay, which I rarely do, if there is inlay, then I would put composite onto inlay, composite into the tooth, and then inlay onto the tooth. So onlay, if it's onlay, composite on onlay. If it's inlay, composite on the tooth. And I will cement it, I'll seat it. And with composite, you have to be patient. You need to, it's a thixotropic, so you need to really wiggle a restoration gently and push and wiggle and push. Make sure you keep removing the excess. And the beauty is that you can take as long as you want. You don't need to tack cure it. You don't need to worry about the mess. It's very nice and easy to remove the excess, but you need to make sure you keep pushing and make sure you do the flossing in between. Some of the dentists ask me that, you know, when you floss, don't the inlay come out? They don't. If you're using composite resin, they really stabilize, to really stay there nicely. So I would floss right at the end, I would floss again, and then I'll push one more time, make sure it's seated completely, and then start curing it. Curing wise, I would cure at least 60 seconds per surface. If you have a very powerful light, then you can do 30 seconds. With regards to porcelain, the treatment is different. So if you have, if you're doing porcelain, then you can use 9 to 10% hydrofluoric acid etching for 90 seconds for feldspathic porcelain, or for 4 to 5% hydrofluoric acid for 20 seconds for Emax or lithium disilicate. So lithium disilicate needs lesser concentration and lesser time to etch. Once that's done, you remove etch, clean the surface, and then you can put the onlay in alcohol and ultrasonic bath to remove some of the excess material, or you can use etch again, just a normal phosphoric acid etch, and then leave it for 90 seconds and then clean it off to remove that excess material if you don't have ultrasonic or alcohol bath. Once that's done, then you treat the tooth the same way as the composite only. So you put silane, heat cure it, heat treat it. So in the sense that you put it in a heater, and then once it's done, you would then put your composite onto the onlay and onto the tooth. Now, one question I get asked a lot is that, do I need to put adhesive resin, like a bond? If you're using OptiBond FL, do I need to put bond onto the onlay or inlay before I put the composite onto the inlay or onlay? There has been different opinions about this. In my clinical practice, I do put adhesive resin. So I put bond onto inlay and onlay, onto the surface of the inlay, onlay, and onto the tooth. And then I would put composite. So in my experience, it works really well, but I know some of the clinicians, they don't put adhesive resin onto inlay and onlay. But for me, primer or silane on its own is not wetting the tooth in the surface of the indirect restoration enough. So I use adhesive resin or bond onto the indirect restoration to just wet it nicely. So then when you put composite, it flows really well. So I hope you found this useful, cementing versus bonding. 3 tips. You need to make sure you decide before you prepare the tooth whether you're going to, what material you're going to use, and whether you're going to cement that restoration or bond. Mainly, my decision-making factor would be whether the tooth has enamel or not, and what type of restoration I am doing. You can still do IDS, immediate dentin sealing, even if you are cementing the restoration, because there are some studies which shows that IDS reduces sensitivity of the tooth. And don't forget to use Vaseline around the crowns when you're using cementing. However, I don't do this when I'm bonding the restoration, because it is very technique sensitive and can become very fiddly. So don't use Vaseline, because inlay and onlay, when you're bonding, you don't have enough surface to hold on to. So I hope you found this useful. If you have, please share with your colleagues or friends. If you have any question, contact me on social media or go to my website www.drdevangpatel.com. In the next video, I'm going to show you a video on how to remove excess composite from the interproximal area.